Hello, everyone. My name is Valeria Maggiolo, and today we'll be talking about what if mental illness isn't just in your brain. We've been taught that mental illness lives in the brain, but what if that's only part of the story? What if anxiety, depression, and even how we process emotions aren't just influenced by thoughts, but also by trillions of microbes in our guts? This isn't just a science experiment, it's a deeply personal question. Like many people, I've seen firsthand how traditional mental health treatments can feel inconsistent or incomplete. So I started wondering, could we be missing something? So, mental illness actually affects over 1 billion people globally, yet solutions remain fragmented. So, medications help, but they don't work for everyone, and the side effects are quite common. This gap has led scientists to investigate the fascinating idea that our gut microbiome, which are the trillions of bacteria living in our digestive system, might be communicating with our brain, influencing how we feel, how we think, and even how we behave. This idea is rooted in a concept called the microbiota gut brain axis. Research by Crine in 2019 shows that microbes can send signals to the brain through neurotransmitters, immune messengers, and the vagus nerve, which actually acts like a two-way highway between the gut and the brain. In fact, about 90% of serotonin, which is a mood regulating chemical, is produced in our guts. So maybe feeling down isn't just emotional, it could also be microbial. Now, here's where it gets tricky. You might think, great, I'll just take a probiotic. But most probiotics don't colonize the gut long term. Our microbiomes are unique, like our fingerprints. So instead, diet appears to be a more powerful and lasting way to influence the gut brain axis. Research by Dash in 2015 emphasizes that dietary patterns, not pills, can meaningfully shift mental health outcomes. So, what kind of diets help? The Mediterranean diet is often cited, but the effects are modest. More controversial is the ketogenic diet, which is a low in carb and highly anti inflammatory. A study by Dr. Westman in 2022 shows that it may help patients with chronic mental health conditions, especially those resistant to the medication. These findings raise difficult questions like what if we have over medicalized mental illnesses and actually undervalued food? Now, if we go deeper with amino acids, we usually think of them as muscle builders, but gut bacteria actually use them to create dopamine, GABA, and serotonin. O'Riordan in 2022 describes amino acids as an underutilized prebiotic, a way to nourish our microbes and, by extension, as well, our minds. So it's not just what we eat, it's how our microbes actually use it. This brings us back to the bigger question. What if mental illness isn't just in our brain, but also in our gut? In a world of rising mental health issues and limited treatment access, the gut based interventions could actually offer affordable, low risk, and highly personalized care. This isn't about replacing therapy or medication, but actually enhancing them with an overlooked ally, our microbes. So I will leave you with this. If you could improve your mood by eating differently, would you do it? And if our thoughts and feelings are shaped by microbes, who's really driving the car? This isn't just a new science, it's a new story about what it means to be human.